Welcome into the Mountain Valley News today, and I'm Monk Blevins, and we wanted to come to you and give you an update on the coronavirus. And we've got a majority leader, Nathaniel Ledbetter, with us today. And of course, most of you probably know he is on the task force, which is kind of handling for the state of Alabama this coronavirus. And so we're going to get him on the line right now and start talking to him. First of all, welcome in, majority leader, and we want to thank you for what you're doing, and I know it's been a busy schedule for you, and we appreciate you taking time out of your busy schedule to talk to us.
Absolutely. I appreciate the opportunity to get to talk with your folks, Mountain Valley News and WVSM. Appreciate you guys letting us be on here and maybe talking about some issues that we're facing in our state with the coronavirus and going over some things we've seen and are looking at. And certainly today we've had a couple of hours of conference calls with the governor and with the task force and also with the legislative body. So it has been a busy day, and Mondays are usually like that. But, we hope, we go forward. I think we've got a game plan the governor set forth going out with the stay-at-home order Friday. The computer-generated models show that will save lives. I mean, everything that they do is based off stats that has happened in other countries and looking at what we can do to better protect lives in Alabama. And certainly I want to applaud Dr. Harris. I think him and his staff has done a great job. Of course, we on the task force, we're on the call with doctors all across the state, and UAB's certainly been a mainstay for the task force with their doctors and physicians, and a lot of good information from them this morning. But we've got a challenge going forward, and we've not hit the peak yet. I think in the next couple of weeks we're going to see it peak, and maybe what we're looking at probably is between the 15th, 16th, or 17th of April that we should have the peak of the virus, and maybe by then it'll level off and start heading down some. But I certainly think what she did, or the mitigation that has been put out there, is going to save lives in Alabama.
Oh, absolutely. And I did see earlier this morning where they had, I guess, and I'm not sure who put this out, and said they had adjusted the death, rates that they kind of thought what was going to be in Alabama, and they've lowered those now, and that's probably just from what you guys have done. So, I think people's got to take this serious. I think in the beginning, maybe people didn't think much about it, but this is a serious situation.
It is a serious situation, and the thing about it is, the stay-at-home order, if we do it, if we continue to do and do the mitigation like we've been talking about, it's certainly going to save Alabamians' lives, and that's what we're trying to do. I mean, I know there's certain times where you have to get out if you run out of food, or if you have to go get gas, or you've got to go check on a sick family member or elderly family member. But besides that, if we can just keep our distance, the 6-foot distance that everybody's talking about, washing hands, and my goal is to wash it 10 times more than I normally wash them a day, and do that, and certainly keep our distance and pray, that this gets past us. But the thing about it is that I want to say, Mark, and is nobody's been through this before. I mean, we don't. Everything we do is trying to save lives for the people of this state. And I think it's working, but I mean, the best you can do, we've seen what's happened in different parts of the country and different parts of the world. So it is serious, and it is something that we need to take serious. Today's report we got from Dr. Harris, there's 127 cases in our state. There's 250 people that's been hospitalized. And off of those 250, half of those are in ICU. And we've had reported about 44 deaths at this time. Interestingly enough, when they first come out, they talked about it was mostly attacking older people, the virus was. But that's not the case. The statistics in Alabama show that 44% of the people that has got the disease is under the age of 65.
Right. Yeah. I guess looking at this, Nathaniel, with what the governor put in place on Friday, and I'm sure she thinks this is going to be enough to manage the crisis. What's your thoughts on that? You think if people will follow what she's put into place now, you feel like those numbers? I know we got a peak at some point, and we haven't got to that probably at this point yet. But do you think with the things that she's put in place that we'll be able to manage this crisis and hospitals won't be overrun and those type things?
Well, yeah, that's a good question, and that's the goal. I mean, as we talk today, the Corps of Engineers has been all over the state of Alabama, and they have prepared to set up hospital beds in the Civic Center in Huntsville, the hotel there beside the Civic Center in Birmingham and Mobile and Dothan. We have prepared to set up hospital beds all in those areas. But that's in my, listening to everybody, that's worst case scenario. That if we don't follow the guidelines that's been set forth by the president and by the governor, that could happen. I think if we'll follow the guidelines, and statistically speaking, it shows that we can reduce the loss of life. One thing of interest out of this morning's conversation on the conference call, we've got 270 healthcare workers in our state that has fell ill because of this virus. So that's taking out a portion of our people, our frontline people. That's, man, I mean, really and truly, if you look across the country and our nation and state to state, they have become heroes. I mean, going into the battle every day, knowing that they're risking their own life. And I can't say enough for our first responders and our hospital workers, our doctors and nurses. And, it's been amazing how people has pulled together. And I think, that's one thing, Monk, especially in our area. People work so well with each other. And I think that's going to, at the end of the day, because people working together and helping each other out, I think we're going to save lives in our state. The teachers in our county, as has been giving out lunches for kids that might not be getting them otherwise or not. So that, everybody has played a part. And certainly I think that makes a difference.
Oh, no doubt about it. And it's been amazing to just watch and hear the stories of people, what they're doing and how they're going out of their way. And of course, churches have been affected by this, and it's amazing. I'll get online and start looking, and it's amazing how many more people are that I see. That seems like there's a lot more praying going on, and really, you think about it, they're probably, with the preachers being able to go online and having to do their services like they're doing them right now, they're probably reaching more people like that than they really were just preaching in the church. And so, that's not a bad thing.
No, it's not. And I've seen some of those same statistics, and I think we got to continue doing that. One thing of information, too, that we talked about this morning, Don Williams is the head of the Hospital Association. At this point right now, we still have about 52% of our hospital beds in the state of Alabama available. We've got about 14,000 beds, and almost half of those are available. And we still have 800 ventilators that's available. There's only about 35% of our ICU capacity that's available. The big challenge in our states, just like every state, and what we see on the news at night, is the PPE equipment and getting that. And it's been kind of, I've had 3 calls from different companies here in DeKalb County that's willing to retool and make protective gear for our hospital workers. So it's like you said, everybody's pulling together, and that certainly is having an impact. I know one of the companies here in DeKalb's doing the test kits. One of them's doing gloves, and I had one call me just this weekend about this face shield. So I think, and that's happening all over the state. And that was one of the things. I was with the governor last week for a couple hours, and we talked about all this. And one thing with the PPE equipment, that she wanted to keep some of the Alabama companies working, simply because they were producing equipment for people not only in our state but across the country. So that's important, and we got to continue to provide as much as we can for our people.
Absolutely. Well, I know on Friday, of course, Governor Ivey and had a 4:00 press conference, and I'm sure this was not what she wanted to have to do, and but she did placed the order that the stay home order, and I guess what is the difference? What's different about the order that she gave on Friday, which started on Saturday at 5 o'clock, than what we already had in place, Nathaniel?
Yeah, it's the two orders are similar. It pretty much all the essential business were the same. It did change how many people could be at a grocery store at one time, a big box store, to half of what the fire code capacity is. It changed. The stay at home was a little more strict. It was only if you had to get out, like we talked about earlier, for essential items. If grocery stores are checking on the elderly or things like that. That's the main thing. Of course, if you're a worker at one of those essentials, certainly you've got the right to go to work and back. But that's the biggest thing I think, Monk, it was changed was that.
Right, and I know a lot of people, and I've saw my son-in-law being one of them, where they had gave him a letter or something to say, hey, I'm an essential worker. Is that something that you have to have in Alabama, or is that just maybe if they're going out of state?
No, I would recommend it. If you got a worker that you're having to go back and forth to work, just ask them to give you a letter. And that's one thing. Attorney General Steve Marshall was on the phone with us this morning, and if you get caught without it, it's a Class C misdemeanor, and they're not wanting to enforce that right now. But they got to educate local law authorities, on what can and can't be done. So that process is underway. And listen, the thing about that is nobody wants to take anybody's rights away. That's not what it's about.
Right.
It's about saving lives. And, especially with the people that may have it and not even know it, and they go visit their grandmother or they go visit their niece or nephew, and then all of a sudden the whole family is spread through the whole family. And even though that one person might get over it, they may be a carrier that gives it to somebody in their family that's not able to get over it. We just this latest last night, a member of the Alabama House of Representatives' sister passed away, and she was a nurse. So we've got to really protect our nurses and our doctors. And the more we can do this, the better they can serve us by being able to help more people not getting sick themselves. So it's important that we maintain our distance when we see people. We take care of all the precautions that they talk about with cleaning their hands and wearing a scarf over your face. If you have to get out, if it's something that you just got to do, we got to take it serious. Even though we think that we hadn't seen it right here locally, that something hadn't happened, it can, and we've seen that in Jackson County, and I just urge everybody to just for the next couple of weeks just take a lot of precautions and listen. Nobody in state government or local government in the county or the city want to be making these kind of decisions. I promise you, they'd rather be dealing with fixing somebody's road or working on pay raises for teachers or something like that. But these are the times we're in, and I think all of us working together, we can get through it.
Oh, absolutely. And a couple of things. This morning when I started to come up to the office, there was there wasn't but just maybe on Highway 35, which how the traffic is on that road, 2 or 3 cars that I passed all the way up here. So people are looks like, and in this area, maybe people are taking it seriously. And of course, I know, we had talked about doing this show, and actually you were going to come in the studio, and then, after talking about it and with the order that was passed on Friday or went in effect on Saturday, you felt like it would be better if we did it over the phone, and I think that was a great move.
Well, the thing that we want to try to do, if it's an order that the state has, of course, it comes through Dr. Harris with the Department of Public Health, and the governor issued it. But I think, as majority leader, we want to follow the rules that the governor set forth. And I thought, by doing it by phone, that would be doing so. So that was the reason for that. And the thing is, Mike, we got to look at too. Of course, I know the nursing homes has put a no visitation policy in order, and rightfully so. Brandon Freeman farmer that's over the Nursing Home Association was on the phone with us this morning. I think they got some 231 buildings in our state, some 21,000 beds, and 31,000 workers. And they've got COVID-19 in about 14% of their facilities.
Wow.
And they're trying at all costs to keep it out, because that is, those folks are the ones that's at the highest risk. So they're certainly trying to take care of them, and people's just got to be patient about going to see their family in the nursing homes right now. And, some I've seen on TV that went to the window and things like that. But the thing we got to do is use the utmost precaution around our senior citizens.
Oh, absolutely. And, I guess you mentioned this, but Dr. Harris, what is his prediction on when he thinks the peak will actually hit in Alabama? Has he made a prediction on that? Or?
Yeah. One thing we did talk about that this morning. The one thing we talked about, and there's several different models out there where you get generated models off computers. It gives you, and it's based on what you're doing, how you're doing, how to slow down, how to do the mitigation. But almost all of those models, and they look at several different ones. And about all of them say that it's going to peak around the 15th or 16th of April.
Okay. And
one of them, the University of Washington's got one that a lot of people's talked about. It's the IHME model, and a lot of folks have been watching it. And since, believe it or not, Monk, and I guess this is what you talked about earlier, but since the governor had issued the stay-at-home order Friday, that model shows the loss of lives in Alabama had decreased. And I think that's important for people to understand. I mean, that's why they did it, was to try to save lives.
Oh, absolutely. And, and I think you mentioned this, but, hospitals, I mean, right now it seems like they have the equipment and the things other than maybe the PPE that they need. But for most of the patients right now, they seem to be in pretty good shape if for the patients who are having to go to the hospital. Is that correct?
Well, it is, and if we'll continue to do what we're doing, I think they can handle it. But also, as we talked about earlier, they've also had to set up precautions in case we don't continue, and we have overflow from the hospital. That's why they're setting up the Civic Center in Huntsville, and the Jefferson Civic Center Marriott there beside it. Of course, they looked at facilities in Mobile and also in Tuscaloosa and Montgomery and Lee County. So, I mean, it's very important that we don't have to use those. And we talked about we got 800 ventilators available but that's out of 1,800. So we're using over 1,000 ventilators probably right now. Now, all of them's not COVID-19 patients. Understand that.
Right.
And they've done a pretty good job finding some ventilators that they've been able to refurbish. And Dr. Harris said they should be getting those in this week. And we're up to 1,800 total ventilators, and we've got about 800 available. But if you look at the numbers and how fast it went up from just last week to this week, we had very few hospitalized, and now today we're over 250 in the hospital, and over half of those are in ICU. And we will probably we're going to see that number increase, maybe by that much more, before we hit the 16th.
Right.
And the thing is, the worst part of it's probably in front of us in the next 2 weeks. But once we get to the peak and start leveling off, I think then we'll see some improvement in what's going on.
Oh, absolutely. Again, with all of this going on, of course, small businesses, and of course we have the newspaper here, and our workers started working from home today, and we're learning all kinds of new techniques. We had our first conference call, and it was interesting, to say the least. But a lot of these things, we set up early, and when I say we, I'll have to brag on my son. He actually set us up so we can be working from home, and just like we're working here at the office. And so, a lot of people are learning a lot of new techniques that they haven't ever tried before. So, that's another
Well,
big thing.
it is, and that the thing about as bad as this is, and there's going to be some things come out of it that's going to help our country and help our local county and their state. I mean, the things y'all are having to do, the distance learning that they started today with our school systems, and so I mean, there'll be some challenges ahead of us, but there'll also be a learning ability there that I think we'll pick up and you'll see us use more. I think you'll see, we actually, with our openings meeting law in the state of Alabama, we've kind of handicapped the county commission and the city councils, and we've had discussion about that. In today's technology, there's ways I think that you can do it better. And of course, that's what was set up several years ago. And you certainly, as a member of the media, you guys have got to have total access, and that's the way it should always be. But when you got somebody and you're looking at them and they vote and you can see it, I mean, that also is something I think we need to take into consideration. So that's one of the things too I think you got to look at. As far as the small business owner, the federal government has rolled out 3 different packages, and the last one certainly is beneficial to small business, the Paycheck Protection Program. And I know a lot of people are looking at that, and I would encourage them to do so. And I think that as you know, we all work with has probably been fluid, and it will continue to be so. But I know the local banks, if you got a local bank and you go through them, I think that's where you're going to be able to work with your folks. And certainly you got to keep up with all your paperwork and all your receipts and any payroll that you might have, and take care of it, and then just follow the procedures that's laid forward. And I think there's opportunity that there's a portion of that funding, if it goes to salaries that was prevented from people losing their salary, and you're a small business and you get this small business loan, there's a portion of that can be forgiven. So I think that's a positive for our small businesses, because those are the ones that's going to hurt the most.
Oh, absolutely.
And we talked about the factor that what was happening to the people in our state with the virus, but there's also damage being done to our economy. And Alabama in my lifetime was doing better with the economy than any time I've ever seen. Our unemployment was 2.7%. We added some 14,000 new jobs, or 20-some thousand new jobs last year, with a total of $14 billion brought in the state. So this has certainly slowed that down. And, one thing I think we got to continue to be positive about that and trying to bring that back. And certainly think that President Trump has done a good job as far as putting out these packages so that it doesn't just devastate our economy.
Oh, absolutely. And one thing I want to do while I'm thinking about it, and I've got several more questions that we want to talk about, but I wanted to let anyone who is listening, if they have a question that they would like to ask, if they will text that to 256-717-9839, we will get that question on for them. And, I know a lot of people have a lot of questions and a lot of concerns. And, I know small business, restaurants, and so many small businesses right now, are scared to death about what they're going to be able to do. And these loans, I know personally that, these loans, they did get the information in our area over the weekend. And so I know those have already been, people are already applying for those, and I actually was one of those. And the thing right now, it looks like the main thing you need at this point, it would be your 2019 941, which is your payroll information. And if you can get that from your accountant or whoever is handling that for you, and get those papers to the bank. Now there may be other things they need, but those are getting in process. And this is a all over the nation problem going on. And so I think the quicker you can get your application and all those things in, the better chances you'll have hopefully getting some money.
That's right. Yeah, and I think that's important that they, in the payroll document, and if they can, if you did your taxes last year month, I believe it would just be smart if you just carried all of them.
Oh, absolutely.
When you fill out your application, because there'll be things that they can get off of that. And it's, there's a limit on how much you can get back. And I think you got to look at that too. But anyway, I'm glad it's out there. I think it's going to save some of our businesses, and I certainly appreciate the president putting it out there. And we were talking about earlier about conferences that we've been on today, conference calls. I'm sorry, that we've been on today. And the reason we do them on Monday is because Governor Ivey has a conference call with Vice President Pence every Monday. And the Vice President told her this, and most of the time in the last couple of weeks, it's been the President and the Vice President. I think it's just the Vice President today. But he had told her that we had done 1.67 million tests, and we'll do another. And by the end of this week, we'll have another million tests in our country. And the one thing that a lot of people have been seeing is the test that they can get back within 15 minutes, and that's going to be a game changer going forward, I think. And I think Dr. Russo, I hope I'm saying her name right, Russo and UAB had talked this morning, and they're setting up one of those machines now. It's a tabletop style machine, and she says that they'll be able to help not only just theirs, but they'll be able to help other testing sites as well with this equipment. So I think that's certainly going to be a game changer, and it'll allow us to kind of isolate going forward. Once we kind of get it under control, I think it'll help isolate some of the cases.
Yeah, we do have one message that come in, the question, and they said, will Alabama receive any of the new COVID-19 tests that give results in 5 minutes? Do you know anything about that, Nathaniel, if that's something that will be?
That's what I was just talking about.
Okay, so that's
it'll be probably 15 minutes. 5 minutes, I think if it's one way, it's 5 minutes. If it's positive or negative, I don't know the exact. But right. I think the maximum is 15 minutes. And some of these test turnarounds, and I think that's why you'll see this next couple of weeks in the state. But some of them is taking 7 to 8 days because of it's just been overwhelmed. I mean, you can only imagine. We were talking the other day, Mark. We've had some tragedies in our country. If it's a hurricane, it's usually to a generalized geographical area. And even during 9/11, if you've been to New York where that happened, it was probably within a half a mile square. But I mean, we're touching every state in the United States, every county, every city, and 180 countries. And so you can imagine how overwhelmed it is to get the equipment, the protection equipment, and the testing equipment. It's become difficult. But I will say, with the executive order the president has given, we're seeing some change in the pipeline with equipment coming down. Now, the only thing with the PPE equipment, we're at a shortage in the state hospitals. We've got to get more in. Unfortunately, the national stockpile is out. We probably won't be receiving any more from them, and the state stockpile has run out. So we have got some sanitation in to help sanitize what they're using. So maybe that'll be beneficial going forward.
Oh, absolutely. Well, Nathaniel, I know, during all this, of course, you guys were in session, and you had went on your spring break when this kind of hit, I guess. And so what's going on, or what's going to happen with the session now that with all this going on? I'm assuming you guys are not meeting right now and maybe have postponed that, or so what's actually going on there?
Yeah, we had last Tuesday actually, we had to get a quorum together at the State House, both on the House and the Senate side. If we didn't do that, we would actually lose the session. The week before that, the speaker and I were there, and he had to gavel in and declare a lack of a quorum, which means we didn't have enough for a quorum. Wasn't anybody there that day. But he had to do that so we could set a date. And the Senate had set the 31st. So we had to go back on the 31st by their resolution, because if we didn't, what happens by the law is that the next day goes into effect. Well, the way it reads in our Constitution, we've got 105 days to get 30 session days in. Well, if we hadn't went back and taken a procedural vote to change the rule coming out of the Senate, we actually would have lost the session. I mean, it would have just eaten day after day after day. But luckily enough, we had enough members to have a quorum in both chambers. We changed the rules for the Senate. We set a date certain, which is the 28th of April. And the way we set the rule, if something were to happen and it gets worse, then the pro tem and the speaker can meet by themselves and declare not a quorum and move it to May the 4th. And that's kind of the plan. The thing that we are bound to do by state law is the budgets, and we haven't got either one of those out yet because we were really just getting started good in the session. So that's something that we will have to deal with going forward.
Yeah. And another thing, we're talking about the effect to small businesses, and no doubt it has affected so many. But also, going forward, this is going to affect the state of Alabama and you guys, the Education Trust Fund, which has been really good, and General Fund. And so what's the thought on that with everything going on? I know it's got to be affected. So have y'all got any idea, maybe how that will be affected?
Well, no, we don't. And the reason we don't is because, we stay a month behind really on what our revenue is. And we haven't seen what kind of impact it's going to have on our budget yet. So when we met with the governor the other day, Kelly Butler was there, and he is over finances for the state. And, that's one thing we'll have to see. I mean, luckily enough, with the Education Trust Fund, we were in pretty good shape, and we've got some money in the bank. I mean, I think we got like $500 million in the bank from the AT money, which is technology money, and then we've got another 32 million. I think we've got like a total of that at 800 million. We got a 300 million amount like in a rainy day funds, basically what it is. But that's just shy of $1 billion. But the problem with that is our budget last year was $7.2 billion. So even though that's a lot of money, it doesn't run the education system for a long time. But our hope is, luckily going into this year, we were up about 8% in our education trust fund budget. It was up that much. And so if we have a loss of 10%, then it's not going to hit us that hard. We'll be seeing something like a 2% drop from last year. But the thing about it is, which will be 1 point some odd billion dollars, but going into the next fiscal year. But with that being said, what our plan is to try to, if we could just budget it, what last year's budget was when we start back, I think we'll be way ahead. And hopefully that's what we'll be able to do. But at this time, that's just a guessing game until we see what this first month of revenue is going to look like after the virus is hit.
Right. Well, a little bit. What about the general fund? I mean, I know that's got to be affected too, and the one thing I do know, and talking to you, and just how you guys have worked over the last several years, you were able to start putting back some money, and kind of a rainy day fund, if you want to call it that, and luckily you guys had put back money for, and I know it's not near enough for what you're going to lose, but that was some a wise decision, I want to say, on your guys' part to be able to do something like that. So.
Well, and it benefited the state. I mean, we put money back the last 2 years out of the general fund, which first couple of years I was there was short several $1 million. But the economy's got better, and then of course the internet sales is going into the general fund now, which has helped tremendously.
Right.
So I mean, there's a lot of things that's changed, that's helped, and we had just with the work that we had done, just really got the general fund to where it was not underwater, and the money we put back, and of course when we got the BC settlement, I think one of the smartest things, and that we've done then, is we paid off $600 million of the rainy day fund. It was taken out during the recession before we come in office. So that money's been put back in there. It's there now, and we've actually added a certain amount to it every year to try to get it back up to where it was. So we have put money back, and hopefully we don't go into proration. That's what we're trying to avoid, because it's hard for educators, it's hard for departments to set their budget and know what they're going to be doing for the next fiscal year if they're not able to see what their budgets are going to be. And it's certainly hard if they have to go into proration. because that means they'll have to start laying people off.
Right. And then another one is the local legislation. And, I know they depend a lot on you guys to help them with some projects they have going on. So what will be the effect for local legislation through all of this?
That's a good question. The local legislation, of course, you're aware of it. You've been in local government, so that's, you know how it works. But the way it works with local bills is it has to be advertised for a period of 4 weeks or 4 times in the paper. And the thing about it is going through the process, it has to go through both the House and Senate and then be signed by the governor. If we don't get it in this session, it's all lost. You lose it.
Right.
But, we can come back in a special session later on. The governor could call for local bills, but the problem you got with that, you just don't have enough time because you have to run it for 4 weeks. It takes at least, if you put it right in then, it'd take at least 5 days to get it out of session.
Yeah.
So those bills, and I know there's some we've got locally. One of them, I think, Rainsville is expanding the city limits. I think we did one for the mental health for the county, and then there's others. I know Marshall County, because we talked to them, has got one. They're wanting to build a new school down there, and it took a local bill to get that going. So there's a lot of those. If we're not able to go back in, that will unfortunately lose. And so I know for the local governments that means a lot, but it's unfortunately it's the times that we're in.
Yeah. We've got another question to ask you here, and I'm not sure who this is from. But they said, ask Nathaniel, when the shelter in place is over, will businesses gradually be allowed to start back, or will they just start all at once?
I think when the shelter in place is over, I think that we will have a gradual start on those businesses that can do it by letting the least amount of people go back to work and then gradually grow back into it. Now, being that said, we've hadn't been here before. We don't know. We're in uncharted waters. I mean, we're making decisions based on what we feel like's best, and it's not easy. I mean, I have to give the governor credit. I asked her the other day, I said, hey, holding up, how you feeling? She told me, said, it's not a step for a high stepper. We're in this thing together, and we got to keep working it. And she does every day. And, we do a conference call with somebody just about every day. I've done one with the mayors across the state, and I've done one with the CEOs of rural electric. Certainly, we have had people in government step up. I mean, they really have, and be accounted for, and certainly, Dr. Harris has done an outstanding job. I certainly appreciate the work that Dr. Williams has done with the Medical Association. It's been amazing, really. And there's no telling. I mean, I don't know if these guys are even getting to sleep right now, to be honest with you, Mom.
Oh, I can't even imagine. And I know it's just, just me, myself. I mean, it's hard for me to sleep at night just thinking about all the things that are going on. And so I know you guys being involved in this and having to make decisions, not daily, but sometimes hourly, about what things going on. So
you're exactly right. It changes. I mean, from moment to moment. And I talked to Dr. Mackey, our state superintendent, this morning, and we tried our distance learning starting today, and then Friday's when the governor put the stay in place order, and so that kind of you have to work around those things. He is. I tell you, I told him the other day, I'm certainly appreciative of what he's doing. I mean, he is working in his office and out of his office, and the reason is because they had someone test positive for COVID-19 on his floor he works on.
Oh, wow.
So they've worked with a skeleton crew, but man, they've continued to do a yeoman's job, and certainly appreciate that.
Yeah. And speaking of this, I know one thing that, people probably, and you can talk to this more, need to be aware of, if you feel like you're getting sick, don't run down to the hospital or to the emergency room and have them, call your doctor, let them, tell you what you need to do, because, the one thing I've found out during all this, and I've coughed a couple of times during this show, is, it's allergy season. And so and with this going on, it's a little bit scary if you've got allergies and you start coughing and things, and then, the first thing you think is, uh-oh, have I got it? Do I need to go to the doctor? So, and I know they don't need people who are just having some kind of allergies or from pollen or something to run to the hospital, and they've got their hands full without that kind of thing going on right now.
Yeah, we talked about earlier about some of the things that we've seen come out of this. I think telemedicine is going to be more prevalent coming out of this. To let you can call in on that and let the doctor look at you and over the internet and see and give him the symptoms, and he can look at you and see what you need to do from there. And you mentioned the hospital. One thing I do want to do, we've talked about the healthcare workers and teachers, and of course we need to talk about the people that keeps the grocery store shelf stocked, because I know that's been a tough job. But Patrick Trammell at the hospital in DeKalb County has done a great job. I talk to him on a regular basis, and about what they're doing, what they need, and man, they have been on top of it. And I'd seen the number of people they had tested for DeKalb County. I think it was like 150 people or more. So they've been busy and doing a good job. We certainly want to tell them how much we appreciate what they're doing.
Oh, absolutely. And there's so many people, like you said, the people working at the grocery stores, and it's just unbelievable the amount of groceries that they've had to just keep restocking and restocking. The one thing, people panic when these type things happen, and they probably buy a lot more than what they should. The grocery stores, as far as I know, they're going to stay open unless, something crazy happens. And so, they don't need to panic and go buy up everything they can get their hands on, because they're going to be able to get the things they need.
Yeah, that's exactly right. And the thing about it is, we have to be careful about getting to it. We're all nervous about it. And we all got family. We don't want to get people sick. We don't want to run out of milk or bread or groceries. But we have to, kind of settle down and look back and just get what we got to have and get out there. Don't carry your whole family. Just carry one or two people. You don't want it to go in there. Go by yourself. That's the thing about it. You don't want a whole family. I had a report. I got a call from Trustville yesterday, and some of the stores down there were soccer moms coming in with their kids, burning 2 hours just to have something to do. That's not why these stores are open. I mean,
Right.
They're open for essentials to get what you need and then leave. I mean, they're talking about even setting somebody at the door, and you got to show them what you're getting so you can get in there and get out, because you don't want to hurt somebody else. You don't want to affect their life or get them sick or get your family sick. And the thing about it is, they just come out last week and ask you to wear a mask, because it's probably, and by the numbers we're looking at, it's more contagious than we even thought it was.
Right.
So I think it's important to know that.
Yeah, and that was actually my next question about wearing the mask. They've come out now and said that if you're out, and going to be around people, it's probably better to have a mask on. And it's not necessarily, from my understanding, and you correct me if I'm wrong on this, it's not necessarily to keep you from catching something as much as it is if you have something, not giving it to somebody else.
Yeah. Well, that's the thing. And we talked about that earlier. You don't want to hurt your grandmother or your niece, and we talked about earlier that 47% of all these people in Alabama are below the age of 65.
Right.
So you certainly can affect someone in your family if you catch this virus, and you might not even be sick, you might not even feel sick.
Right.
But if you just decide, well, I got to get out of here, I'm going to go to Walmart for a couple hours, and you got it, and then you come and see your grandkid, or you see one of your children or what, and you can actually give it to them and not know you've even got it. And I think that's so important.
Yeah. Another question, and nobody sent this one in, but I think a lot of people, with this shelter in place or stay at home order, that doesn't necessarily mean you can't get out in your yard or maybe walk around in your neighborhood as long as you're, keeping a distance if there's other people out walking in the neighborhood or whatever. So, you know, if you want to talk a little bit about that, and am I correct on that? It's okay to get out and outside your house and maybe walking around in the neighborhood as long as you're keeping your distance and those type things.
Yeah, you're exactly right. And fortunately, of course, we live in a rural county, and if you can get outside and walk around, and a lot of folks, got big yards and they even live on a farm in DeKalb County. You can certainly get out. And I told my wife the other day, if we stay out a couple more weeks, I'm finally going to have my house around the outside looking better because I've weed eated it, weed eated it and cleaned up around it. So I know she appreciates that. But anyway, yeah, you certainly can do that. And I would, encourage people to do that.
Oh, absolutely. The weather's turning really nice. And, I saw a lot of people, and me and Sherry both have been talking about this. Uh, you know, we're going to have a really nice looking neighborhood because that's one of the things, most people can't get out other than they're working in their yard, and they're doing flowers and they're doing all kinds of things. And my yard looked terrible, and my neighbor, he had his looking really good. So I finally hired somebody to come in and kind of clean mine up so that I told him, I said, I was getting embarrassed. I didn't want to embarrass you with the way
Yeah,
my yard looks.
yeah, exactly. A couple of things, Monk, I do want to mention. One of them is that the governor has been working on a website, and she is really emphasizing it this morning, and it's called All Together Alabama, and I think it may be up and running now. I know this morning they were hoping to get it up today. I'm not 100% sure, but I think it could be up and running now.
Okay.
But that's something that's going to give. She's going to be able to put on there every day what's going on, what they're seeing, and how it's affecting our state. One thing too, before we have to go, I want to mention. I know, as you know, of course, me and you've been friends for a long, long time, and we. Our families have been close for many years,
Yes.
and I think it's time that we pray for each other and certainly pray for the people around us and in these challenging times. And one thing I think is vastly important that we need to do is there's a lot of people right now that don't know where they're going to get their next paycheck from. They don't know how they're going to feed their family. They don't know how or when they'll get to go back to work. And there's help for those people. I mean, if you're feeling depressed, and we worked on this mental health issue this last year quite a bit, and had got it out of the House and had sent it to the Senate, and we'll see if we'll get to finish it or not. If not, we'll certainly come back next year. But there are a couple of numbers that I would like to give out
Okay.
that I think is important for the people that may be listening. And if you feel depressed, you need to talk to somebody. Hey, pick up the phone and do it. I mean, you got people around you that loves you. You got people around you that cares for you. I mean, even our pastor wouldn't mind if you give him a call, or if you know a pastor in your area, give them a call. They'll talk to you. That's what they want to do. But the crisis center for Central Alabama is 205 323 77. And that's the crisis center for Central Alabama's 205 323 7777. And for North Alabama, it is 256 716 1000. If you just need somebody to talk to, pick up the phone, call 256 716 1000. We'll put that on our website, and I hope that you and WVSM will put that on theirs.
Oh, absolutely. Yes.
It's important during these challenging times that, listen, people care about people in our area. You got people that love you, and you got people care about your well-being. And I know it's tough, but we're going to get through this. Things are going to get better.
Absolutely. And Sherry did just check the Altogether Alabama is up and running. So, if you have the chance, get on there and look at that, and you can keep updated from that.
And going one step further with that, and this is Governor Ivey had said this morning. Of course, she said, if you are of religion, and of course this coming weekend being Easter weekend, something we should all be thankful for and pray for. And the one thing that she'd ask everybody to do, and I'm going to pass that along, but is if you got an old ribbon that was put up for Christmas that you're just going to use for Christmas next year, you got some in the closet, if you'll just take one of those ribbons and tie it around the mailbox or tie it around the tree, she wants to symbolize that as a ribbon of hope for our state. And I certainly think that is a good thing to do. And, during these times, any small thing that we do, I think, to help each other or to show we got hope and that we're going to get through this is important.
Yeah. Is there a certain color ribbon, or is it just
No,
just
it's
any kind of ribbon?
No color. Remember, you got to stay at home. So whatever you got at the house.
That's right. That's right.
Just pull it out of the closet and tie it around the mailbox or around the tree, whatever color you got. It doesn't matter, but it just symbolizes a ribbon of hope for our state, and certainly think it's the right time to do that. And then we just continue to pray for each other.
Oh, absolutely. And again, I want to thank you and the governor and everybody involved in this. You guys, y'all have stepped up to the plate and have done a great job. And in a situation that's just unbelievable. 3 months ago, we would have never, ever thought about being in some kind of crisis like we're in right now. And, this is something you can't plan for, but you guys have stepped up and done a great job. And I just want to personally, thank you for the job you've done and what you stand for.
Well, I appreciate that. Appreciate y'all, and appreciate you giving us an opportunity to be on here and kind of give everybody an update on what's going on. We certainly don't mind doing it again.
Oh, absolutely.
And,
yeah.
I think it's important that people knows what's going on and be safe. Have everybody be safe, because we've seen what we've been told by the professionals what's ahead of us, and but we're going to get through it.
Oh, absolutely.
There's going to be a better day.
Yeah. Well, maybe a couple of weeks down the road, we can get back together and do this again. And, at that time, I pray that things will be going the opposite way. Things will be getting better, and we can see the light at the end of that tunnel at that time.
Yeah. And that's one thing I told my granddaughter the other day. She was here and spent the night with Teresa and I. And I told her, with everything going on in the news, sometimes I think I'm guilty of watching the news too much. But I told her, I said, you need to remember this. And I said, because this is something that you're going to be talking to your grandchildren about. And we pray and hope that we can mitigate to the least amount and on the other side come out stronger than we've ever been.
Oh, no doubt. Well, Nathaniel, I appreciate your time. I know it's been a crazy 3 weeks, month, whatever, how long it's been now. And we appreciate your time. I know you probably got calls lined up waiting after this. And so we don't want to keep you any longer. But again, we're praying for you, and let Governor Ivey know that we're praying for her, and we appreciate what she has done and how she's handling things for it.
Well, thank y'all. Thank you for the opportunity, and just everybody stay safe, and let's help each other through this.
Absolutely. You have a great night.
Thank you.
Thank you. Well, there you have it. Nathaniel Ledbetter. Of course, he is the majority leader, and we appreciate him and his time tonight. And we will try to get back together in a couple of weeks with Nathaniel, and maybe we can get Steve Livingston online too and talk to him. And but we appreciate you guys tuning in, and we do pray that you will stay in, listen to what they're telling us to do, stay at home unless you just have to go somewhere. And we're going to get through this. And again, if you need help, Nathaniel has given those numbers out. Let's don't. Make sure that you get the help you need. And, we appreciate you guys, and we hope you stay safe, and we hope to talk to you soon.